morning. I am Justin Esperlas, a student nurse from Foundation University College of Nursing, and today I'm going to perform open gloving. Asepsis or sterile technique consists of those practices that eliminates all microorganisms and their spores from an object or an area. The use of sterile gloves is the heart of aseptic technique. And there are two methods for applying sterile gloves, the open gloving and the closed gloving. And the open gloving that I will do today is used most frequently in doing procedure that require sterile technique, but that do not require donning a sterile glove. The purpose of this procedure is to prevent the transfer of microorganisms from hands to sterile objects or open wounds. So before doing the procedure, we need to have an assessment first. First is to identify appropriate time in donning sterile gloves. The second one is to inspect the glove package to determine whether it is dry or intact. The third one is to assess the local environment. Determine if the area is suitable for opening the package and applying the gloves. And also if there are presence of airborne contamination. The fourth one is to assess that nails are filed short for presence of open cuts and lesions, because this may harbor microorganisms and prevent the nurse from participating in a sterile procedure. So the last one is to examine the ungloved hands for any presence of open cuts and lesions which may harbor microorganism and prevent the nurse from participating in a sterile procedure. So the expected outcome is to don and remove the gloves without contamination, and also for the client to be free from any infectious microorganism. So the equipments needed are a packaged sterile gloves that is appropriate in size, just like this, and a flat surface. Before we start the procedure, first we need to perform hand hygiene, because clean hands reduce the number of microorganisms that could be transferred if gloves is accidentally punctured or tear. Next thing to do is to inform the client that you are establishing a sterile field and request cooperation in not touching the sterile gloves or other sterile objects. Next is to read the manufacturer's instructions on the package of the sterile gloves. Okay, so here it is a powder-free latex surgical gloves. So it indicates the manufacturing date, expiration date. It is a size 6, and it is said here that this product contains natural rubber latex, which may cause allergic reactions in some allergy individual users. And sterilization is guaranteed unless package is open or damaged. Okay, so this is for single use only. Okay, so that's the content. Place the sterile glove package on clean, dry surface at or above your waist. Okay, so I place it here at the table and then above my waist. So open the outside wrapper by carefully peeling the top layer back. Remove the inner package, handling only the outside of it. So open the outside wrapper. So open the outside wrapper. So here. By carefully peeling top layer back. So that. Okay. Carefully top. Okay. Remove the inner package, handling only the outside of it. Place the inner wrapper into a clean, dry surface. Okay, so I'm gonna place it here. Okay. So this maintains the reality of gloves in the inner packet. Moisture on the surface will contaminate the gloves. So next is to carefully open the inner package using flaps and expose the sterile gloves with the cuff end closest to you. Beware of the immediate environment when applying sterile gloves to avoid accidental contamination. Okay, so I'm gonna open this. So next thing you're gonna do is to identify the left and the right hand. So in gloving, you need to glove the dominant hand first. So my dominant hand is left, so I'm going to glove my left hand first. So remember, you only have 2 inches wide cuff to open the gloves, and you do not want to touch the rest of the part because it will contaminate the gloves or the sterile field. So I will open this one. Okay, so like that. Okay, so as I said earlier, I'm going to glove first my dominant hand, which is the left. So I'm going to grasp the left glove using my right hand. So here's my right hand. So we can only touch this inside part of the glove because we do not want to contaminate the outside part. So once I touch this part, it will become unsterile. So okay, so I will slide my hand here and then I will tuck my thumb here because it facilitates ease in wearing the gloves. So like that. Okay, so then I will fix the gloves and do not touch the outer part of the gloves. And then now this is sterile and you do not want to touch anything unsterile because it will contaminate the gloves. So next is I'm going to grasp the right glove using my left. Okay, so like this. Okay, so like this. And put the thumb away. Remember to keep the thumb away. Like that. Okay. So now I'm going to slide my right hand and okay, I'm going to slide my right hand and tuck my thumb so that I can easily. Okay, so okay, so now I'm done. I'm done in gloving. So after this, you do not want to touch anything so that you cannot contaminate sterile field. So after putting the gloves on, you need to interlock your fingers like this in order to make sure that the gloves fit into your hands. Okay. So now I will proceed to the removal of the gloves. So in removing gloves, you need to slip the glove fingers of the dominant hand. My dominant hand is left under the cuff of the opposite hand, or grasp it here in the outside part of the. So I will pull this down because it's already contaminated. You do not want to contaminate your hands. So exposing the thumb part. So like that. And then after this, I will use this thumb to grasp the inside part of my dominant hand. And then like this. And then transfer it to the non-dominant hand. So using my dominant hand, I will grasp this part and then to remove the gloves in my hands. So now after removing the gloves, you will dispose it according to the institutional policy. And then after disposing it, you will perform hand hygiene. And that's all for open gloving. Thank you for watching.